Thank you for joining me to come and talk about arthritis management. I'm here to really discuss how occupational therapy can make a difference in arthritis management. As often, arthritis will give us different symptoms of pain, swelling, inflammation, that aching, that stiffness. You might have decreased flexibility, range of motion, and all these other symptoms on top of that. So, as an OT, we're really here to help to regain this ability to perform those important daily tasks in different ways, like using adaptive equipment, making environmental adaptations, compensatory strategies. Maybe we'll utilize splinting or positioning and really giving an education on arthritis symptoms so we can manage them better. So, before we get started, understanding that there are different types of arthritis. That way, you can understand what type of arthritis you are dealing with. The most common you might hear is OA or osteoarthritis. It can also be written in medical forms as degenerative joint disease, or as many people will hear, the wear and tear of arthritis. This is most common in the hands, hips, and knees, and it really is just the cartilage breaking down around the bones, causing bone changes. This is most common with aging. Most people will have some form of osteoarthritis. That is the most common, that's the main form of arthritis, and we will be talking about many strategies to address osteoarthritis. But to be aware, there are other forms of arthritis. There's also rheumatoid arthritis or psoriatic arthritis. So, rheumatoid arthritis is an autoimmune and inflammatory disease. So, the immune system actually attacks the healthy cells of the body, causing inflammation in different parts of the body, mostly the joints. It's most often in the hands, wrists, and knees. That's another type of arthritis. There is also psoriatic arthritis, which is a chronic inflammation of the skin and the joints that causes pain and stiffness and swelling of the joints. So most often we are dealing with osteoarthritis, which really is that breaking down of the cartilage causing those bone changes. We'll often experience pain, aching, stiffness, decreased range of motion, or you could call it flexibility in our joints, and swelling. What puts us at risk of arthritis is often age. Increasing age, we're at an increased risk of getting arthritis. Gender, we know that females are at a higher risk than males to develop arthritis. This also can do with our bone density. We know that women are at a higher risk of developing osteoporosis, which really is the softening of our bones. So overall bone health does impact our arthritis. Obesity, thinking about the amount of weight that we're putting on our joints and in our bodies. It definitely makes sense. The more weight we add to our joints, the more they really are working to maintain our body weight upright, as well as genetics could put us at a risk of arthritis. So we know arthritis is common. There is plenty of research behind it. We know that people are likely to develop arthritis. You may develop it for different reasons. Some could just be normal aging. You develop it over time, over your lifetime. You could have traumatic arthritis, say you had a traumatic injury, which we're seeing more of nowadays. So how you get your arthritis really depends and can vary person to person, but you will likely experience the same symptoms. So, how we can support arthritis through daily life change is really where occupational therapy comes in. We often, to support our arthritis and really our management through every day, you'll want to increase your physical activity. You'll want to increase your muscle strengthening all the muscles around the joint. That way we're relying more on our muscles to do activities. The stronger we get, the better we are overall in better health. We will also kind of manage our weight better with increased physical activity. However, finding the right amount of physical activity for you may depend on where your arthritis is at this moment, which we'll talk about a little further. Other ways that you can support arthritis, people often will take medications. It might be over the counter, such as NSAIDs, the ibuprofen, Tylenol, to kind of help with some of these daily symptoms that you might experience. However, please talk to your doctor, make sure you understand what it is doing to your body, and make sure that they know if you're using that long term. Other ways to kind of support arthritis in our daily life is through using supportive devices. That could include a cane, crutches, or even a walker. Often we hear of people getting arthritis in their knee. Maybe they'll want a cane for one-sided, but maybe you also have arthritis in your wrist. So a walker might be a better solution to really support not only the arthritis in the hands or wrist, but also supporting the knee. So the type of device really depends, but feel free to talk to your doctor, occupational therapy, physical therapy, to really see if there's a supportive device that is best for you. And then we also want to support the learning and self-management skills, which is really the big focus on today's discussion. Different ways to really manage our arthritis through learning different management skills that can be applied to our daily routine. So the first way that we might address our self-management skills, occupational therapists will refer to them all the time. We do these three terms. It's called modification, adaptation, and compensation. And it's really how we go about an activity or task to really meet our individual needs, especially with the different symptoms and things we're experiencing. So with modification, it's really changing the environment or activity. This could include practicing good ergonomics, avoiding movements that cause pain. Maybe we'll use a basket to carry items instead of holding them in our hands for a period of time, because that could easily fatigue the hands or cause extra pain. Modifying the activity or environment. I always think modify the activity, such as brushing your hair. Maybe you have arthritis and pain in your shoulder. So really lifting up over your head is a challenge for you. So you could modify the activity by using a brush that has an extended handle. And that way you're still able to do the activity. You're avoiding those movements that really cause that additional pain to you. We can also kind of modify us doing activities every day. Overall strategies, maybe we need to sit instead of stand for a period of time. Maybe to brush our teeth, we really are standing for a period of time where we're putting extra pressure on those lower extremity joints and causing much more pain than we need to, when you could just sit for the activity. And either way, you're still able to do the activity, you're really just changing up how to do so. Or maybe it's the opposite for you, depending on how your experience with your arthritis is. Maybe you need to get up more frequently. Maybe you have pain sitting for a period of time. So for you, getting up and moving more frequently is actually the best solution for you, depending on how your experience is with that pain. So with modification, we're really focusing on the way that you do the task. And then we're going to talk about adaptation and how adaptation is kind of different than modification. When we're talking about adaptation often uses a device or a tool to assist with an impairment to accomplish that typical activity. So we're adapting a task by using a tool. So, or we often refer to like adaptive equipment. So maybe your arthritis prevents you from bending over to reach for your shoe, to put your shoe on. So you might get a shoehorn or a sock aid to eliminate the overall idea of bending down towards your feet. So that could be one solution. I often think of the hand arthritis, that it's in our hands or wrists. It's very painful. Maybe you're a card player. So for you, playing cards is vital. That's something you love to do. You look forward to the social interactions with your friends, but physically holding those cards in your hand for a period of time to play the game could be something that actually triggers some of your arthritis symptoms. So something as small as a card holder that will hold them together for you and puts less pressure, and you're less likely to fatigue in your hand. So that's a great solution, especially for arthritis of the hand. And we would call that adaptation because we're really utilizing some kind of tool or device to still be able to perform that activity. And then lastly, we have something that we refer to as compensation. So this is completely changing how you approach an activity. So one way that you might do this, especially with arthritis, the less you have to do to irritate the joints in your hand, probably the better. So one way we'll talk about work simplification strategies. And this can include reducing the number of steps to complete the activity. So maybe we're getting dressed in the morning. Instead of picking out all of your individual clothing items separately, you take everything out at once, place it all in the bed. Now you're reducing the number of times you have to get up and go to the drawers, open the drawers, close the drawers, come back, get dressed. So really eliminating not only the number of steps to do it, but we're reducing the amount of strain we're putting on our bodies to perform the entire activity. We're also reducing the amount of energy that is needed to complete the task. So that's one way that you can kind of compensate and change the approach you have to an activity. We also talk about the 4 Ps when it comes to compensating. That could include prioritizing, planning, pacing, and positioning. So maybe you need to change the type of time of day that you perform the activity. Maybe for you, you do very well in the morning, so you prefer to do all of the important tasks you need to do for the day in the morning because your arthritis doesn't flare up. But maybe for you, your arthritis really flares up later in the day because you've done more in the morning, you've done too much throughout the day, and you really start to see that flare up towards the end of your day. So prioritizing what needs to get done first, what I can do later that requires less energy, and even just pacing yourself through different activities throughout your day. That pacing piece is very important. Pace yourself throughout the day. Even if you do a lot in the morning, make sure you're taking those rest breaks in between. And pacing your activities is also just going to help you to avoid that added pain and fatigue, which could be triggered from your arthritis. A couple other ways you might compensate in the way you approach an activity. I often say if you are having wrist pain or your arthritis is really kind of impacting your hands and wrists, try to use more of a whole arm motion or more of your whole upper body and not just the small joints in your hand and your wrist. By using the whole arm, you're actually reducing how much is put on all those smaller joints in the body. So my example is twisting a doorknob. So instead of just twisting it with your wrist, use your whole arm to really twist the doorknob to open it. It's just the way you approach it. Now you're using larger muscles, larger parts of the body, instead of those smaller areas and muscles that are going to fatigue sooner. Or maybe You can work with an occupational therapist. If a doorknob is something that's going to be a constant problem with you, it will always kind of trigger your arthritis, then maybe you need to work with an occupational therapist to make some environmental modifications. This could include maybe just modifying the type of doorknob that you have. Maybe we need to do a lever arm instead of a doorknob, because that motion will actually reduce how much force and energy is needed from the smaller muscles and joints of the hand. And that's just an easier task for you overall. So there are different ways we can really approach and add these different concepts into our daily life and really kind of change them based on what our needs are and when our arthritis symptoms are kind of worse versus when they're better, and just little strategies to really work on that management piece. Because there's no direct solution and way to fix and treat arthritis, but what we can do is manage the symptoms to the best we can. We can make some of these daily routine changes so that we're really being kind to our body, to our joints, and to really kind of reduce that exasperation of symptoms from the arthritis. So, the whole point of self management strategies today was really to help you still do the activities that you want to do, but also reducing the strain that you put on the joints without exasperating your arthritis symptoms, because we can't fully find a solution for arthritis, but we can manage these symptoms and manage our everyday routine so that we can maximize our energy and what our body will allow us to do in a day, because we understand that arthritis can have a big impact. We know how the pain can have a full body impact on us. So we want to make sure we're doing as much as we can, but also pacing and prioritizing what's important to us before we really kind of trigger some of our arthritis symptoms. So I hope some of these self-management strategies have been helpful to you. I think this is really a great way to work towards the management of arthritis. And I hope that you can see how some of these examples can really help you in your daily life and routine. And let's continue to fight the pain and symptoms we experience with our arthritis, because we are not our arthritis and we will not be defined by it. So, thank you so much.